Hi, everyone. I'm Dr. Shiva Ghofrany, an OBGYN since 1999, who ironically had ovarian cancer myself when I was 46 years old in 2016. And I want to talk about my experience because what I hope more than anything is that I can help educate you, not only by giving you the bullet points, but also through my own experience and journey. I also hope more than anything that what I can provide for you is a massive decrease in your fear. What I typically advocate for is being proactive without being paranoid. Because if we work together, then we'll be able to find things early so that we can fix them. So that is my intention with telling you my story. Please remember, as I'm going through this story, that I was diagnosed at age 46. And as of the time of this taping, I am now 54. That is 8 years that I have been completely fine after what was a really challenging journey. And I say that so that I can offer you hope. Because all too often we are told as women and people with ovaries that ovarian cancer is the silent killer. And that means that we are essentially being told that we have no agency over it and that there's nothing that we can do. And that is simply untrue. If together we learn the signs and symptoms, together we know how to diagnose it early, we can have millions of more people throughout the world like me who are here to talk about it. So let's go back a little bit in history. Like many women, I had very painful periods, the type of periods where I would be lying in bed in a fetal position and was often told by everybody, those are just your periods and that's just what happens. As it turns out, when I turned 29 and I was in medical school, one of my periods was so debilitating and I had a lot of pain when I was actually having intercourse. And that led me to have a pelvic ultrasound finally. And that went to the diagnosis of an endometrioma. Endometriomas are growths of endometriosis in the ovary. In my case, it was 17 centimeters, literally this big. Now, how does it get that big without you noticing? Well, like most women, I had some signs and symptoms, but I kind of told myself it's probably just my period. I'm going to the bathroom a little more frequently, maybe because I'm drinking more water. So all the things that we tend to do when we blow off our symptoms are exactly what I did. Please don't do that. So I went to the doctor. I had a pelvic ultrasound. The pelvic ultrasound showed an endometrioma. Endometrioma is endometriosis, which are cells that are like the uterine lining. They're not exactly the same, but they're like the endometrial cells in the uterine lining that can grow elsewhere in our pelvis or really almost anywhere in our body and cause very debilitating cyclic pain. In my case, that huge cyst was removed from my ovary. And then for the next several years, because I was on birth control pills, I was actually okay. Then came that stretch of time where I was trying to get pregnant. I was getting pregnant. I was actually having miscarriages that were probably not due to my endometriosis in my case, and I was birthing babies. So my endometriosis was actually largely controlled. I was having other gynecological issues, but not my endometriosis. Flash forward to age 45. My period started getting increasingly painful. At that point, I was off birth control because I had had my tubes just cut during a C-section. And because of that increasing pain after 2 or 3 cycles, I did what I would tell you to do. And I had a pelvic ultrasound, which found a small 4-centimeter ovarian cyst that again looked like an endometrioma. Now, rarely endometriosis in the ovary, called an endometrioma, can malignantly transform into ovarian cancer. Now, in my case, I did not think it was ovarian cancer, nor did my very, very adept and educated surgeon, who is a gynecological oncology surgeon, who essentially does almost exclusively cancer surgeries. Because she had trained me, I went to her to do my surgery, even though we both agreed that based on my age, my risk factors, and how this cyst looked on my ultrasound and then MRI, it was unlikely ovarian cancer, but there was a possibility based on the MRI results. I was prepared as we went into surgery that while it was likely benign, there was a chance it was going to be malignant. When I woke up from surgery, it turns out it was cancer. Because we found it early, my doctor was able to do my surgery robotically, which means through those small incisions instead of a big incision. But I still had to have a very extensive surgery called a staging procedure, where she had to meticulously remove my uterus, my tubes, my ovaries, a lot of lymph nodes, and something called the omentum, which is the fatty apron of tissue that kind of lies on top of all of our organs. Once she did the staging procedure, then she learned what stage my ovarian cancer was. Unfortunately, during that procedure, even though she is an amazing surgeon, there was a small complication where one of the instruments actually put a tiny little burn on top of my bladder, which 1 week later ended up manifesting as actually a hole in my bladder, as the urine actually would build up in my bladder and I wasn't able to get it out. So a week after my initial surgery, I actually had to go back to the hospital for another surgery to fix the hole in my bladder. Now, I tell you that part mostly to make it clear to you that even the most amazing of surgeons who is so well trained and so meticulous can have complications merely because our bodies are not perfect, easy instruments. I had a little bit of scar tissue from previous surgeries that I had had, and sometimes these things happen. What's really important about complications, even in the best of surgical hands, is that they are identified, as mine was, and then they are fixed. Mine was fixed. Was it easy to go through the surgery, the initial surgery, the second surgery, the complication, the repair of my bladder? Absolutely not. But does it happen, even with the best of surgeons, even when the patient is actually a doctor herself? Yes. The second reason I want to tell you about that is because, as terrible as it was at the time, I knew that I was incredibly lucky that the complication was identified because I advocated for myself. I called my doctor. She was very attentive. She told me to go to the emergency room based on my symptoms, and I managed to be okay. So I want to also offer that up for hope. Now, as it turns out, my ovarian cancer was stage 2, endometrioid ovarian cancer, which means it came from the endometriosis, which is not very common. And I needed to have 6 cycles of chemotherapy that went across 18 weeks. Each cycle is 3 weeks in my case and in many ovarian cancer cases, meaning you have chemotherapy on day 1, but then it takes about 3 weeks for that cycle to work. And then you have your next chemotherapy regimen 3 weeks later. So 6 cycles of chemotherapy that took about 18 weeks. And yes, I had symptoms. I lost all my hair despite trying to save it with something called cold cap, where they freeze your hair follicles to decrease the odds of the chemotherapy getting to the hair follicles and making you lose your hair. It didn't work in my case, but it works in many cases. So by my 4th cycle, I shaved my head. And the truth is, unlike millions of people who want to wear a wig, which is absolutely appropriate, wear a hat, or wear some kind of covering on their head, I chose to walk around bald. It felt more authentic to me, which is a really important point. If you or anyone you know are going through ovarian cancer or any cancer, you get to choose how you want to traverse it, how you want to show up physically and emotionally. Do you want to share the journey with people? Do you want to walk around bald? Do you want to wear a wig? Do you want to keep it private? These are all choices you get to make. In my case, because I was a gynecologist, I felt like it was really important to be open and transparent with everyone. It felt more freeing. Shaving my head actually made me feel like I was doing something really strong, and it helped me relate to my patients and make sure that I could show them the face of hope for the future. Besides losing my hair, being very exhausted, sometimes having nausea, and having a lot of body aches from the chemotherapy and some of the other medications that I needed to take, the entire experience was also anxiety provoking because I had 3 children and I had been put into surgical menopause at age 46 where my ovaries were removed. Overnight, I experienced hot flashes, night sweats, anxiety. All of these things helped me as a doctor because I learned so much about what I'd been talking about with my patients, and now I knew what it felt like. So again, the experience of ovarian cancer was nothing I would wish on anyone. Frankly, I would not wish any cancer on anyone. That said, what I've really learned is that cancer invokes far more fear than it needs to. We know that some people are diagnosed at stage 3 or 4 for many cancers. And that means that their survival rates are lower and that their treatment is far more grueling. But if we all work together, we can find different cancers much earlier, where the survival rates are incredibly high. For example, breast cancer, when you look at all stages, has over 90% survival rate. So it should not invoke fear. What I often try to teach my own family, my friends, and certainly my patients is that fear leads to avoidance. And the last thing I want you to do is to avoid seeing the doctor for your symptoms. So please listen to my story. Please take it for what it is, which is hopefully a way for you to understand this disease with a real face behind it. Please know that my experience is not necessarily your experience. So your situation might be far easier than mine or far harder than mine. And there is no judgment in any of this. I recognize that I had a lot of privilege in my diagnosis because I'm a white woman, because I'm a physician, because I'm lucky enough to have wonderful partners in my medical practice and family and friends who supported me. I certainly was able to help myself get through this with hope and strength. You might not have any or all of those benefits to you, and I recognize and acknowledge that. So again, I don't want my experience to be a beacon of hope that makes you feel bad if your experience is harder than mine. But I do want to show you a very real face of someone who has gone through this really pretty awful disease. And I want to shout from the rooftops how much I want to debunk the myth that it is a silent killer. Ovarian cancer symptoms are subtle. They're not silent. And if we believe they're silent, then there is nothing we can do. But if we know that they are subtle and that we can look for the symptoms, be cognizant of the symptoms, and actually advocate for ourselves, then you as a patient and we as doctors can find this early where we can fix it. Thank you for being here and listening to my journey.